It's my pleasure at this time to invite Roberta Steiner to offer a Devar Torah, some words, teachings of Torah, in honor of this Shabbat being in conjunction with the National Council for Jewish Women and congregations all across the country, a Shabbat in commemoration of and in honor of reproductive justice, Repro Shabbat.
Thank you, Rabbi. Isaiah says, learn to do good, seek justice, correct oppression. In Proverbs 31, here it is said that everyone has the God-given rights of life and liberty that is free from all forms of oppression and injustice. Zechariah exhorts God's people to administer true justice, show mercy and compassion to one another. Micha says, and everyone is familiar with this quote, "He has told you, O man, what is good and what the Lord requires of you, only to do justice and to love goodness and walk modestly with your God." Welcome to Reproductive Justice Shabbat. Now some may think, reproductive Shabbat, she's talking about abortion. And they would be partially correct. A person's reproductive health is not only access to safe and legal abortions, although that is a small part of it. It is important that we do not isolate abortion from the totality of a person's health and life. Reproductive justice looks at the whole person and their entire set of circumstances, from age to class to race to religion to sexual orientation. Reproductive justice is about all people, women, men, gay, transgender, non-conforming binary, of all races, ethnicities, and religions. It is the complete physical, mental, spiritual, political, social, and economic well-being of people based on the full achievement and protection of their human rights. We need to ensure that all people have the right to have a child, the right not to have a child, and the right to parent the children they have. Reproductive justice framework analyzes how the ability of a person to determine their own reproductive destiny is linked directly to conditions in their community. And these conditions are not just a matter of individual choice and access. One of the key problems addressed by reproductive justice is the isolation of abortion from other social justice issues that concern communities of color. Issues of economic justice, the environment, exploitation of individuals through their bodies, sexuality, labor, and reproduction, rather than a narrow focusing on protecting the legal right to abortion. Instead of focusing on the means, reproductive justice focuses on the ends: better lives of individuals, healthier families, and sustainable communities. The last 2 years have seen increasingly hostile attacks on reproductive autonomy and rights. Decades after the U.S. Supreme Court established the fundamental right to contraception and abortion, these critical rights are at stake and being openly challenged. In many parts of the United States and around the world, people have only a theoretical right to sexual and reproductive autonomy. Restrictive laws and policies have made it virtually impossible to access the information, services, and providers people need to care for their health and well-being. That's why a coalition of more than 90 organizations came together to develop a visionary policy agenda that boldly proclaims that for people to be free and equal, they must be able to exercise complete autonomy over their bodies. The Blueprint for Sexual and Reproductive Health, Justice, and Rights lays out a broad vision for the future that includes forward-thinking ideas to transform sexual and reproductive health as basic and fundamental measures to correct the backtracking that has taken place in recent years. The Blueprint is a starting point that is intended to provide the scaffolding from which additional policies can be developed. The first principle, ensure that sexual and reproductive health care is accessible to all people. Second, to ensure discriminatory barriers in health care are eliminated. Third, is to ensure that research and innovation advance sexual and reproductive health, rights, and justice now and in the future. And fourth, it is to ensure health, rights, justice, and wellness for all communities. Access to abortion care domestically and globally must be protected and expanded. The ability to decide if, when, and how to have children or grow a family is fundamental to personal autonomy. Indeed, a right is merely theoretical when care is inaccessible or unaffordable. Legislation must be passed to ensure coverage for abortion and contraception in private and government-funded insurance plans and programs, and ending the Hyde Amendment, which withholds abortion coverage, except in limited cases, from those qualified and enrolled in Medicaid, and from our military service members. Furthermore, Congress must end the Helms Amendment, which unjustly restricts federal global funding from not only covering abortion care, but providing financial aid to healthcare facilities that provide family planning or refer patients to a facility that does. In 2012, episode of Fault Lines, Al Jazeera English's long-running documentary series about fractious political issues in the U.S., correspondent Zena Awad interviews Jim Bushey, an Ohio state representative who had co-sponsored Ohio's heartbeat bill. At first, he speaks very assuredly about abortion policy. He believes in the sanctity of life and favors laws that will reduce or eliminate abortion. But he is less assured when Awad asks him, "What do you think makes a woman want to have an abortion?" Bushey pauses. He squirms in his chair. "Well, I'm not a woman, so I can't." He chuckles at his awkward attempt at a joke. I'm thinking now, if I am a woman, why would I want to get... He looks heavenward, as if looking for the answer. I don't know. It's a question I've never even thought about. And that is a question most people, especially lawmakers, should but don't think about. But some researchers did think about it. And last year, the Turnaway study was published by Dr. Diana Green Foster, led the quest for the answer to that question and to investigate how abortion affects women by comparing those who get an abortion and those who want one but don't get it, those who get turned away. It is a 10-year study involving more than 40 researchers, over 1,000 women seeking abortion at 30 facilities across the U.S. The study documents the emotional health, physical health, socioeconomic outcomes. The participants are interviewed twice a year, up to 5 years. They are asked about their emotional, mental, and physical health. They are asked about their life goals, their aspirations, their financial well-being, and the health and development of their children. They are asked about the quality of their intimate relationships. They are asked why it took some of them so long to finally arrive at the clinic. It is a fascinating read that answers the why asked by Awad of Mr. Bushey. It is a great injustice for a man, a politician, a stranger, to impose important health care decisions on a woman he has never met or heard about, or to tell a woman what to do with her body. And that brings me to Purim. We all know the story. Ahasuerus is having a party with his courtiers, friends, nobles. They drink, they eat, they carouse, they drink some more. The king wants to show off the body of his gorgeous wife. He sends a servant to fetch her. Vashti doesn't get credit for her brave stand. It's her body, not his to show off. She claims autonomy over her body. Reproductive justice is about a person having autonomy over their bodies. Shabbat Shalom.
Yasher Koach to Roberta for sharing important words, impassioned words of the importance of this justice issue, reproductive justice. I think we should be talking about issues like reproductive justice more in our congregation, in our congregational life, from the Bima. There are definitely in our congregation a multiplicity of opinions and approaches about how specifically to leverage broader societal institutions toward the goal of achieving reproductive justice, and also a broad spectrum of folks about what reproductive justice means. For more about my point of view, about why I think it's important that we should be talking about it from the Bima more, about why I think it's important that different points of view are respected and brought out, I encourage you to read the op-ed that was published yesterday in the Daily Gazette, Schenectady, that I wrote on the topic of talking more about issues, difficult issues from the Bima. So thank you so much to Roberta for sharing your words of Torah with us. And we continue with the Musaf service for Shabbat and Rosh Chodesh, which can be found on page 428, Chatzi Kaddish, followed by the Shabbat and Rosh Chodesh Amidah, which begins on page 486, page 486, and follow the signposts for specifically Shabbat and Rosh Chodesh. The beginning of that section of the Amidah starts with Ata Yatzarta Olamcha Mikerem. It's a beautiful, beautiful poetic rendering of the importance of Shabbat and Rosh Chodesh together. We rise, page 428.